Hi, my name is Michalla Heighington, and I'm going to be answering some questions about general horse care.
Explain the basics of tack care and the instructor's responsibility.
So, our basic tack care is after each ride, after each use of our tack, it gets cleaned. So, we clean off the sweat, the dirt, the grime. We give it a light condition. We clean our bits with water. We clean our girths. We brush out our saddle pads so that they're free of dust and hair. We also clean out our groom kits after every use too, making sure that our brushes are clean and our equipment that we use to clean our tack is also clean afterwards. Everything is neatly put away in our tack room and it's ready for the next use. My job is to make sure at least once a month I will take my tack and I will deep clean it. And I am really giving it a good clean. It gets a really good condition so that it's soft and supple. I'm making sure that I'm checking for any loose threads, any stitching that's come undone, making sure that stirrup leathers are not stretched out, making sure that buckles are still good, runners and keepers are still good, and that the overall safety of the equipment is appropriate to use. I also make sure that the equipment is still fitting my horses good enough and also fitting my riders as well.
Explain signs of unsoundness and general health of the horse and the instructor's responsibility.
So some signs of unsoundness would be limping. You can see with a front end lameness or a hind end lameness. So with a front end lameness, they will be head bobbing during their steps. So the general rule of thumb is when they bob with their head down on the leg that they press down on, that's the sound leg. And then when they bob their head up on the leg that they press down on, that's the unsound leg. So down on sound is the rule of thumb for a front end lameness. Then you have a hind end lameness. You could identify that by a hip hike. So the hip is raising up higher than the other side. And you can also tell by they could be dragging their hind end or just overall stiffness in their hind end as well. Some ways that you can determine lameness would be, or unsoundness, would be trotting them to and from someone and they're watching how the horse moves and you can see how they're stepping and how their footfall is. Walking, trotting, potentially cantering on a circle both directions, seeing how their balance is through the circle and if they're unable to put weight on a certain leg as they turn. Another way that we can test would be through flexion tests, but that's generally done by vets unless you have experience doing it. The general health of a horse is they are their TPR is normal, so their temperature, pulse, and respiration is at a resting rate. Their eyes are relaxed, their ears are relaxed. They are wanting to eat their food, they're wanting to drink their water, they are happy in their herd, they are wanting to be caught, um, they are not standing off to the side alone, they're not resisting their food, they're not showing any signs of discomfort, and they just generally look happy and well in their field. Um, my responsibility though is I know my horses 100%. I spend a lot of time with them, so I'm aware of their symptoms of when they're feeling unwell versus when they're well. So if I were to give breakfast to my horses and I notice one horse is not coming to eat their food, that would be an alarm for me because that's an unusual thing for them to do and that could potentially lead to something else. So I would be aware of that.
Explain the characteristics of a good lesson horse and school horse, including blemishes.
So I'm going to use Silly as an example as a good lesson horse. We want something that is quiet, even though she's quite large. She's very gentle and she's quite slow. So she's very easy to ride. She's very patient and tolerant, especially with kids that are around her legs or around her face. And if they bump and make a mistake around her, she doesn't mind and is not bothered by that. She is very easy to handle on the ground. She has very, very good ground manners. I could just lightly go up to her and she can move away from me just from the lightest touch. She's very responsive. She has a lot of experience too. So she's 19 years old and she has been through a lot of things. So a horse that has experience is generally a horse that is a little bit more workable with younger students. Some other good characteristics of a good school horse is that they should be able to be pulled out of their field, taken away from the horses and their friends without being upset. going on a trail ride by themselves, having vehicles. We live in a busy area, so having vehicles pass by them and not being spooked easily is very helpful too. Um, some blemishes for a horse that would be okay would be basically any type of visual blemish that doesn't affect their function. So I can give an example on Silly. We might not be able to see it on the camera, but on the inside of the leg, right here on her knee, she has an old scar and she had a lump removed. And that scar is just old scar tissue. It's got a little bit of gray hair and a little bit of scarring on top that doesn't produce any hair. It doesn't look pretty, but it doesn't affect how she moves her knee. She can walk, trot, canter, she can jump, she can do trail rides. She boogies around in the field, so she's very sound on that leg. So that blemish would be considered okay. Some conformation issues could be okay, like they could be potentially pigeon-toed. As long as it's not affecting their stride and how they move, that's okay. Another one would be maybe winging out. That's okay too. Again, if it's not affecting how they function and how they move, that conformation issue is okay. So ideally, if something doesn't look nice, but the horse still works well and they're sound, then that's an okay blemish to have.
Explain the basics of feeding and watering before and after a lesson, and the instructor's responsibility.
So our horses have access to water 24/7. They are able to drink water before and after their lesson as much as they need, but they have adequate time before they ride because they'll be pulled out of their field, and then the students will get the horse ready, and then after they ride, they'll have adequate time to cool down before they go back and drink their water. Same with feeding too, but you should be feeding, making sure that they have been digesting for at least an hour before exercise starts, and that they have an hour to rest after exercise before they start digesting again. If you're feeding a horse grain, you need to make sure that some forage or hay is in their system 15 minutes prior to giving grain, and also 15 minutes after your ride prior to giving, 15 minutes after you feed after your ride prior to giving grain. My responsibility is that I make sure that my horses are fed well before my students come. I know my riding schedule and I know my students' schedule. So they are aware. I'm aware of when my horse needs to be finished digesting and when they're done eating, so that my student can grab them. And then again, we take adequate care after our ride too. They spend about an hour after each lesson cooling their horse out before they even put them back in their area. So they have lots of time to come down from their exercise before they start eating again.
Explain an EAP for an injured horse and the instructor's responsibility.
So an emergency action plan, I'm going to give 3 examples. The first example will be about colic. It's quite a common thing with horses. The first thing that I would notice is your horse, you could have really obvious signs of colic or not so obvious signs of colic. So the obvious signs would be your horse is rolling around, it's stomping at its belly, it's swishing its tail, it's sweating, breathing heavy, it's not wanting to eat or drink water, you haven't seen it poop in a little bit. Those are some pretty obvious signs of colic. Some not so obvious signs would be reduced gut sounds. Maybe they're just standing off to the side and not wanting to eat, but they're not really moving around or making a big deal about it. They could be just chilling and not really, you don't really know what's wrong until you check all their vitals, and then we come to the gut sounds and then they don't have any, so that could be another sign as well. So what we would do when they're colicking, we would bring them out, we would assess the level of colic, we would take their vitals, their TPR, temperature, pulse, and respiration, and then we would check their gums, we would check for their hydration, we would do a pinch test, and we would listen to their gut sounds. All of that information we need to gather so that when we call the vet, we can provide that to the vet so they know the seriousness of what's happening. Then we would follow vet's instructions. So then another example would be to, oh, actually, I would like to add into the colic, if they're thrashing around, I would really try not to let them lay down or roll. They're not, their intestines and their digestive system is not really meant to be flipped upside down, especially when they're colicking. It could cause a lot more damage if that chance happens when they roll. So we just try not to let them roll. If they're being calm and quiet, then I would just let them stand and be calm and quiet. But if they're moving around and thrashing, I would just try to keep them walking and keep them busy so that they don't end up rolling. The The next example would be a puncture wound. So let's say she has a puncture wound on her forearm. We would clean it out first with the saline solution, and then we would check and see to make sure that all the debris is out of the puncture wound, making sure nothing is left in there. And then we would also see how deep it is too. It could potentially be around a joint. So if it is around a joint, that could lead to other issues, but we would contact the vet as we're taking our vitals. So once we clean it out, we're taking our temperature, pulse, or respiration, checking for our capillary refill time, checking for gut sounds, doing our pinch test, checking the color of the gums, seeing how alert they are in the eyes. That's going to give us a really good indicator of the level of pain and the level of distress that they're in. So once we figure out how deep it is and if everything's cleaned out in the puncture wound, we just want to make sure that we don't wrap it and that it stays open. Because when a puncture wound is healing, it needs to heal from the inside out, push all of the bacteria and everything out as it heals. And then as it closes over, as it heals from the inside out, it can close over at the end, and then it's healed. But we would call the vet and follow vet's instructions with that too. We might need some steroidal cream to help it, and we might need a tetanus shot or some antibiotics for it as well. Another example would be just a laceration or an abrasion. If blood is splurting everywhere, we're just putting pressure on it to stop the bleeding, calling the vet right away. And if we have enough hands, the same person or someone else can help take TPR and check the vitals of the horse. I find that making sure that we have the TPR and the vitals ready when we're talking to the vet just helps provide the vet with lots of information so they know what's happening. So if it's just a minor wound and bleeding has just stopped and it's not too bad, we clean it off with saline solution. We would probably put some type of ointment on it, maybe like Dermagel, or if we really need to, we could probably use a steroidal cream if it's necessary. And then we would dress it. So we would put a nonstick Telfa pad on, then we would wrap it with gauze. And then if the injury happened to be on the lower leg, then we can use a wrap like a stable wrap to cover it up. My responsibility is that I should know basic equine healthcare and basic equine first aid. So I live in an area that we don't have access to a vet, and we need to be able to handle things well by ourselves until we can get access to help. I am making sure that I'm up to date with my first aid, with my training. We're constantly doing drills at my barn to make sure that if there is an emergency that we can handle it and that we are prepared for it. So my job is just to stay up to date with everything and keep my training intact so that when we have an emergency, I'm ready for it.